Type 1 diabetes or type 1 diabetes is a disease that has no cure. Treatment for type 1 diabetes is aimed at maintaining stable blood sugar levels. Stable blood sugar will prevent complications and help diabetics can live a healthy life, prolong life. The goal of treatment for type 1 diabetes is to keep the premeal blood sugar level between 80 and 130 mg/dl, 4.4 to 7.2 mol/L, and the 2-hour postprandial blood sugar no more than 180 mg/dl, 10 mol/L. Join Hello Baxi to learn effective methods of treating this disease in the following article. Treating type 1 diabetes with insulin. Anyone with type 1 diabetes needs lifelong insulin treatment. However, patients cannot take insulin directly to lower blood sugar because enzymes in the stomach will destroy it, preventing it from working and reducing the effectiveness of insulin. Instead, patients will treat type 1 diabetes with insulin through injection or pump form. 1. Inject insulin. Treating type 1 diabetes with insulin injections. You can use a needle, a small syringe, or an injection pen to inject insulin under the skin. The type of insulin used and the number of injections per day will depend on the patient's health condition and daily schedule. As age changes, the amount of insulin a patient needs and the number of injections may need to change as well. Types of insulin on the market today include short-acting insulin, rapid-acting insulin, moderate-acting insulin, long-acting insulin, premixed insulin, 2 ingredients with different duration of action. Patients may be prescribed multiple daily injections, which combine a long-acting insulin with a rapid-acting insulin. Several studies have demonstrated that a regimen of type 1 diabetes with insulin injections 3 or more times per day is more effective in improving blood sugar levels. 2. Insulin pump. The insulin pump is automatically programmed to deliver the fast-acting insulin into your body to match your carbohydrate intake and blood sugar levels at the moment. The insulin pump delivers the right dose of insulin through a small tube placed just under the skin, aimed at regulating blood sugar if it gets high. Many studies have demonstrated that in some people, treating type 1 diabetes with an insulin pump can control blood sugar more effectively than with injections. An insulin pump combined with a device that continuously monitors blood sugar can help keep blood sugar levels in check. Insulin pump for type 1 diabetes. Treating type 1 diabetes with other drugs. Medications for high blood pressure and high cholesterol as well as aspirin may be prescribed along with insulin to help promote overall health and treat type 1 diabetes. People with type 1 diabetes are at increased risk of developing it. Higher rates of cardiovascular disease. Medications to treat high blood pressure. Your doctor may prescribe an ACE inhibitor or an angiotensin II receptor blocker, ARB, to help keep your kidneys healthy. These drugs are recommended for people with diabetes whose blood pressure is above 140/90 mmHg. Aspirin. Your doctor may recommend aspirin for patients with type 1 diabetes. It is taken daily to protect the heart if the patient is in a high-risk group for cardiovascular complications. Cholesterol-lowering drugs. People with type 1 diabetes will have an increased risk of cardiovascular disease when blood cholesterol levels are too high. Therefore, these drugs will help patients reduce blood cholesterol levels, preventing complications. Daily blood sugar monitoring helps control type 1 diabetes. For people with type 1 diabetes, close monitoring of blood sugar is important. Blood sugar levels in people with type 1 diabetes can fluctuate very erratically, especially after eating or using insulin. Therefore, proactive and careful blood glucose monitoring is the only way to prevent hypoglycemia and minimize its dangerous complications. Depending on the type of insulin used or the doctor's orders, patients may need to check their blood glucose levels several times a day. The American Diabetes Association recommends that you check your blood sugar before meals and snacks of the day, before bed, before exercise, or when there are signs of suspected low blood sugar. Short. Blood sugar testing for type 1 diabetes treatment. In addition, blood sugar monitoring allows patients to know when they need insulin injections to lower blood sugar or when to add carbohydrates to prevent hypoglycemia. Blood sugar monitoring can be done using a traditional blood glucose meter or a continuous blood glucose monitor, CGM. Control carbohydrates in the diet. To be able to live a healthy life, people with type 1 diabetes need to pay special attention to their daily diet. This is the simplest way to treat type 1 diabetes, which can be done at home. You need to ensure a balance between food and insulin intake as well as daily activity level to maintain stable blood sugar levels. Certain foods high in carbohydrates will cause blood sugar to rise, whereas insulin and exercise will cause blood sugar to drop. So, learn how to determine the amount of carbohydrates in your daily diet to provide enough insulin to metabolize those carbohydrates and maintain stable blood sugar levels after eating. Diet to treat type 1 diabetes. Patients need to maintain a healthy and complete diet menu that includes nutrients such as carbohydrates, fat, and protein in a reasonable ratio, increased fiber, and vitamin and mineral supplements. At the same time, limit your intake of fast-absorbing fats and carbohydrates. Because they can cause abnormally high blood sugar levels, causing weight gain, obesity, and leading to dangerous cardiovascular complications. Exercise regularly. Physical activity can lower blood sugar levels, and help strengthen resistance, preventing the risk of cardiovascular disease. Therefore, maintaining regular exercise is the way to treat type 1 diabetes that all ages should apply. You can increase your workout with aerobics, walking, cycling, swimming, etc. for about 45 to 60 minutes a day. Before you start exercising, you should also check your blood sugar regularly to see how physical activity can affect your blood sugar. Other potential type 1 diabetes treatments. Artificial pancreas. In September 2016, the U.S. Food and Drug Administration, FDA, approved the first use of an artificial pancreas for people with type 1 diabetes 14 years of age and older. A second artificial pancreas was approved for use in December 2019. Currently, several artificial pancreas systems are in clinical trials. Artificial pancreas is also known as closed-loop insulin delivery. The implant will be linked to a continuous blood glucose monitor. The machine will check your blood sugar every 5 minutes in conjunction with an insulin pump. The pump will automatically deliver the correct amount of insulin when the display says it's time for it. Pancreas transplant. In the future, if the pancreas transplant is successful, the patient will no longer need to treat type 1 diabetes with insulin. However, the method of pancreas transplant always carries a lot of risks and the probability of success is not high. Therefore, a pancreas transplant is only indicated for people with type 1 diabetes that is difficult to control or for those who need a kidney transplant. Pancreatic islet cell transplant. In recent years, researchers have been experimenting with a method of transplanting pancreatic islet cells from a donor. This method helps to provide cells to improve insulin production and control blood sugar levels. Hopefully through this article, you have understood more about effective methods of treating type 1 diabetes. Check your health periodically, control your blood sugar well with a healthy lifestyle, as well as follow your doctor's insulin regimen to get the most effective treatment.